Welcome to True North Business Consulting's presentation of a business makeover. True North Business Consulting focuses on health and wellness practitioners, but we can help all service providers. You are the expert of your business, but when it comes to legal, marketing, insurance, and project management, you may get confused. Whether you're starting out or it's time for a different approach, True North Business Consulting can help at TrueNorthBusinessConsulting.com or info@TrueNorthBusinessConsulting.com. And today we're going to have our presentation of a business makeover, where each month we'll bring some tips that can help your business. Health insurance is a hot topic as the President tries to press forward on universal health care. Universal health care is a health care coverage for all eligible residents of a country, which covers medical, dental, and mental health. In most countries, it is paid for by the public in the form of taxes. The United States does not have this type of system for all its citizens. Medicare gives health insurance benefits under age 65 with certain disabilities and to those with end-stage renal disease. To understand the topic, there needs to be a discussion of the basics of health insurance. At least 15% of people in the United States are uninsured. Those that are insured who are not Medicare participants have one of three basic types of health plans. Health maintenance organizations. HMO plans pay for your coverage in advance, rather than paying for each health-related service separately. For the price of a monthly premium, your HMO will offer you a range of benefits from preventative care to dental or vision coverage. You choose a primary care physician and will need referrals to specialists. You pay a copayment for each visit, and the copayment can be about $5 to $25. Preferred provider organizations, PPO plans, negotiate lower overall fee arrangements with an assortment of doctors, hospital clinics, and other health providers. Your cost-sharing rate will be lower in-network than out, but you still have the freedom to step out of network for a treatment if you prefer. Fee-for-service plans, indemnity. This plan reimburses medical providers for each service received on a case-by-case basis. A fee-for-service plan requires payment of an annual deductible before it begins to reimburse the insured for covered services. It also gives family members the freedom to choose doctors, hospitals, and clinics. The problem with these plans is the cost in coverage. The deductibles that need to be met prior to insurance becoming effective can be as a high cost and a cost-cutting technique. It is not unheard of for deductibles to be $4,000 to $6,000. In an average year, most individuals and families will not meet that threshold, therefore paying their medical expenses out of pocket. The other issue is that most employers do not cover health insurance fully. A percentage is taken out of each paycheck. This lessens take-home pay. Then there is the 15% that do not have insurance. Prior to Massachusetts making health insurance a requirement, it, like New Jersey, required that hospitals to take charity cases. Currently in Massachusetts, with some exceptions, individuals who cannot show proof of health insurance coverage that meet the standard of minimum by December 31st, 2007, lost a personal income tax exemption when filing their income taxes. Failure to meet the individual mandate in 2008 started a fine for each month the individual did not have coverage, and the fine is equal to 50% of the least costly available insurance premium that meets the standard for minimum credible coverage. Other states do not have this system, leaving the uninsured to navigate on their own. The uninsured can be further broken down by those who are employed, but their employers are not required by state law to provide any health insurance as a benefit, and the unemployed that have pre-existing conditions which make them uninsurable. Universal health care may or may not be the answer, but there are multi-level issues which need a multi-level approach. When looking at this complicated issue, discussions should focus on how to lower healthcare costs, retain quality, lower deductibles, and decrease the cost of health insurance. Are you a health and wellness practitioner, a massage therapist, a fitness instructor, an acupuncturist, or perhaps a life coach? There are, of course, many others. Then you may benefit by looking at the True North Guidebook for Health and Wellness Practitioners. Within the guidebook, you can find information on planning your marketing strategy, a review of insurance protection, the legal elements of business, and project management simplified. For more information, please go to www.TrueNorthBusinessConsulting.com to buy yourself a copy. True North Business Consulting provides expertise and guidance with the most necessary elements in your business, whether you are starting out or it's time for a change and you need new direction or a different approach with expertise designed especially for health and wellness practitioners. We evaluate your business for the following mainstays: legal, contracts reviewed, legal issues research, and business entities examined; insurance needs assessed, liability coverages analyzed; project management, business planning issues addressed and process education provided; and marketing, strategy planning and campaign development. We also offer services to educational institutions for help on their business programs. If you are interested in our consulting service or educational program, please contact us at info@TrueNorthBusinessConsulting.com. See you later.